everyone. Hope you are preparing for Thanksgiving and cooking your meals and all that fun stuff. I decided I should probably do a video since I am actually on my way home from my latest appointment. This past weekend was my 2-month anniversary since my surgery, so I am officially 2 months out. So I wanted to update everybody and say how I'm doing. And my last video, I put it out there that if anybody had any questions, they could message me, and I did get some messages. So I wanted to address those people and those questions anonymously. So I am now 33 pounds out, lost since I started the liquid diet, which was around Labor Day. So you figure about 2.5 months and about 33 pounds, which I am happy with. But I kind of was expecting to have lost a little bit more this last month because I got stuck. I got stuck for a good 3 weeks. Those of you who see me every day know the frustration I was going through. Basically what happened was I ran out of my thyroid medication. I was already on a pretty low dose, but the pharmacy, I went to refill it and they said it was back ordered. So to come back in a few days, I did. It was still back ordered. Come back in a few days, I did. Still back ordered. It was like this ongoing thing, and I was so confused because I was thinking of my dad, who had his thyroid out as a teenager and who literally needs those medications to live. And here it was back ordered for 3 weeks. So I went to the doctor in that time, and she said that this was actually, I thought it was the pharmacy. She said it was actually a production problem with that drug company, and that they've done this before, which is like so insane to me. But that she put me on a new medication, and literally the next day I started losing again. So slowly, but I'm over the hump, hopefully, for now. Everybody on the forum that I've talked to, that I'm on, said that sometimes you get stuck. Everybody said it's normal and all that. But of course, being somebody who has struggled with weight for so long and who has tried so many things and failed, I of course was like, of course, I had surgery and I'm going to stop losing weight. I'm going to be the person that this fails, because you're just constantly waiting for the other shoe to drop. That's just part of this beast of trying to lose weight when you're somebody like me. But interestingly enough, I just got out of the appointment, and according to the dietitian that I just spent an hour with, statistically, people who have, so you lose more weight if you do the Roux-en-Y gastric bypass. However, it is more of a drastic procedure, which is why I chose not to do it. You have more issues with malabsorption and dehydration. But if you have more weight to lose, that is the gold standard of weight loss surgery to begin with. The sleeve, people typically lose less weight. They lose it slower, but it's, if you have less weight to lose, it's usually fine. So if I were to lose 100% of my excess body weight, my end result would be like 148. And she said she thinks I could achieve that by a year mark, so that's 10 more months. She said basically 6 months is the honeymoon period. They said already I've lost 36% of my excess body fat, and statistically, the average for about a year out is only like 14 pounds away from where I am, and I obviously want to lose more than 14 more pounds. So I'm going for the goal of 100% or somewhere close to that, even if that's not what is statistically normal. I feel like I could do it. So to get there, I have, in the last month, I went back to the gym, and then I got a cold and I couldn't breathe through my nose or my mouth really. So I kind of stopped there, but I will be getting back to the gym. Muscle weightlifting is really important for this point to maintain the muscle that you have, but also it helps with like excess skin and things like that. So I will be getting back into the gym and going back to Zumba classes because I really like Zumba. And you burn a lot of calories in Zumba. So that's the goal for the next few weeks. And then the other thing that I really assessed while I was stuck with the weight loss was my eating. You know, it's hard when your body is telling you you're hungry and you just had weight loss surgery, and it's like, am I actually hungry or what? So I've been, you know, back into tracking. I'm still on such a limited calorie intake, but I want to make sure I'm getting all my protein in and that my calories are not coming from more carbs or more fats. That's been a little bit of a struggle because since July I've been eating vegetarian as a personal choice that had nothing to do with the surgery. It's actually made things a little bit harder because my protein sources are things like eggs, which is fine, but you know, you get a little sick of eggs after having them so often. The other protein sources that a lot of vegetarians rely on would be things like beans or grains and seeds and nuts and things like that. The problem is beans and quinoa, brown rice, are high in protein, but they're also high in carbs, and I want to make sure that I'm filling up on protein more so than I am carbs. So I've been struggling with that a little bit. So if anybody has any great vegetarian recipes that are high protein, low carb, share away, because I've been doing a lot of research, and by research I mean Pinterest, let's be real. So you know, I'm constantly looking for those things. The other things that have been a little bit of a struggle, I spoke about it last time, was the energy level. My energy level was really low, but it's really gotten so much better. I feel much more like a productive human being, and you know, I can actually do things now, which is fantastic. And it's only 2 months out, so that's pretty good, I think. So that's the latest update. I am eating much more of a normal diet. I've gone out to dinner with friends and with my husband since my last video. I've gotten, basically I order an appetizer portion or I order soup. Soup's been good to me. I avoid the bread that they bring to the table, or I have like a few bites of it. And it's manageable. It really is not that bad. And it's not, I don't feel ostracized. I don't feel like an outcast. My friends don't make fun of me. I think because I'm out in the open with it, my friends know what to expect, and I think that that's half the battle. So I'm living a normal life. I'm living a happy and healthy life, and I'm losing the weight that I need to lose. So that's exactly what my goal was. So just some of the questions, I want to make sure I get to those questions that people asked me after the last video. I did get some messages asking. One of them was about the hospital stay itself. So first of all, I did everything through St. Luke's, which is in Allentown. The head campus is in Allentown. I was never a St. Luke's person prior to the surgery, so I really didn't know what to expect. I was more of like a Hunterdon Healthcare. If you're from the area, you know who I'm talking about. And I was kind of like skeptical of St. Luke's, but they were awesome. The hospital stay was amazing. The nurses were all fantastic. I had so many doctors and PAs and things like that coming in, and they all had wonderful bedside manner. And the awesome thing about the floor was, and the program was, that this is literally all that this program does. They don't do other weight loss things or other, GI things. So this was what they do. So when I was staying in the hospital, I did have another patient in the room with me, but she had just had the same procedure as me. So it was great to be able to know, okay, they're going through the same thing I am. My husband was able to stay with me overnight. He actually slept in the bed. So I stayed in a chair pretty much the whole time. Anybody who's had abdominal surgery, basically that's what they recommend. They wanted me sitting up. It makes it easier to stand up, and they want you getting up and walking regularly. So I was up and walking as much as possible. And interestingly enough, my roommate, she was not, and she had she had back pain. She was older, and I think she just had a harder time healing. So she was not getting up and walking, and I think that actually, put her at more of a detriment, and it made it harder for her. So she did stay an extra night in the hospital. I was able to only stay one night, which was wonderful. I was happy to go home. I did sleep on the couch the first few nights, but the hospital stay really was not that bad. I was up and walking, and everybody there was wonderful. So that was one question I got. Another question was about the malabsorption. So basically what that means is, the nutrients that you're eating, are they still being absorbed when in digestion? So if you get the Roux-en-Y, which is the gastric bypass surgery, that's the gold standard of weight loss surgery, you have typically, the food that you eat doesn't get fully absorbed through the digestive process because your small intestine is being rerouted, and the small intestine is where the majority of your absorption of your nutrients happens. You also have possibly a more likelihood of being dehydrated because of that same kind of reason. So with the sleeve, with the gastrectomy, malabsorption, they don't touch your small intestine, so it's not as much of an issue. It is, as part of an issue. The dehydration is the biggest factor for patients of gastrectomy. So that was the one question that people had, malabsorption in the two surgeries compared to one another. Another question that I've had was about drinking alcohol. So it's recommended after surgery that you don't drink alcohol ever. And honestly, I'm okay with that because I don't really like to drink anyway. If you're a college friend of mine, shut up. No. No, I don't like the taste of alcohol to begin with. So, and I don't like the headache I get from wine and all of that. But there are several reasons why they suggest you don't drink after surgery. The first and the biggest one is that food addiction, which is why a lot of overweight people are overweight, and that was something that I had to deal with. Food addiction can very easily be replaced with another addiction, and they don't want that to be alcohol. If you have a family history of that, that's something you really have to think about. The other thing is that because of your stomach being cut in half, your tolerance for the alcohol is drastically reduced. So your 2 sips of wine would make you feel buzzed and possibly drunk. And I know some of you might be like, wow, that's freaking awesome. Talk about a cheap date. But the problem is, let's say you go out for happy hour and you have 2 sips of your drink and you're feeling drunk, you're going to be driving like that. And clearly that's not a good situation. So, not to mention it is acidic, and you want to make sure you're taking care of your stomach and not causing it unnecessary trauma. So those are the basic reasons why they suggest not to drink after surgery. However, everybody does things a little bit differently. And I met with one of my friends a few weeks ago who also had the same procedure as me. And she was like, yeah, I've had a few glasses of wine, here and there at different events and went out to dinner or whatever. And she said she was fine. She was totally fine, and she didn't feel any different really than before. She said, drinking less because of the tolerance situation, but she wasn't feeling more inclined to go drink and all that, and she wasn't feeling really sick from it or anything like that. So, I guess to each their own, but that is something that you want to think about. Is it something that you're going to be able to live your life without drinking alcohol? So, when I have a really long day at work and my kids are driving me nuts at school, instead of going home and having a glass of wine, I'll go home and have a cup of tea or a cup of coffee that brings me joy. It might not calm me down like the cup of wine would, but I'm okay with that, and I'm fine with not drinking it. So yeah, so that's that. That was, I think like 2 or 3 people sent me questions about the alcohol consumption. So basically that's the latest update. I hope that the next time I update you guys that I've lost more. And it's getting into the holiday season, so that's a struggle for everybody. Tomorrow is Thanksgiving. It's going to be a very interesting day, considering basically the whole holiday is centered around gluttony. But that's that, and hopefully everybody is doing well and has a great holiday. Like I've said from the beginning, I enjoy sharing my experience with people, and hopefully I'm helping people out who are looking into this surgery themselves or who have questions. So if you have any questions at all, just message me. I keep it completely anonymous, and I have no problem at answering any questions you have. All right, guys, have a happy holiday, and I will talk to you soon.